But when you get older, your erections don't work quite as well. So the spontaneous and morning erections, everybody gets REM sleep erections. When you have rapid eye movement sleep, you do get erections. That's normal and natural. But as you get older, there's a diminution in that. Also, the erection's not as rigid because the blood flow in it isn't as good, and that stocking is not as tight. You don't necessarily feel that you're going to have an orgasm as accurately as you did when you're younger, and you're not able to actually expel the ejaculate as far out. So no more games after you're older. Also, you don't need to ejaculate as much. So actually, couples that I see are quite happy sometimes, even if they're not reaching orgasm, because they have a different quality, a more intimate quality of sexual experience. So they're less orgasmically driven than the younger man. Now, this is just a little graph showing you that some men really have trouble reaching orgasm. Some of them are very close. They can't quite reach it, and other men are very low on the sexual mountain. They're not that aroused, and that's the reason that they're not reaching orgasm. But sometimes we see this in men, especially who have neurological changes, like with multiple sclerosis or something, where it's much harder to reach orgasm. So why do we even ask about sex? It's because these dysfunctions are so common and they're so distressing. And they can signal other illnesses. If you have erectile dysfunction, it could be depressed, you could have cardiovascular disease, I'll talk about that. And it also influences other illnesses. If you have erectile dysfunction, then you actually could become depressed over that. Sometimes we see people that are even suicidal, that they feel they're not a regular member of society because they don't function sexually. And it can expose other health issues. So one of the ones I want to talk about is that erectile dysfunction, or ED. Another way of looking at it, it's actually an endothelial dysfunction. An endothelium is the lining of your blood vessels, and it's a very active substance. It produces all sorts of good things, but you want healthy endothelium. What gives you that? Exercise and diet and good genetics. So if you look at the carotid artery, which is in your neck, or the coronary arteries around your heart, and you look at the penile arteries, you can see by the time that your coronary artery is blocked and you have a major angina or a major heart attack, those penile arteries are already blocked a long time ago. So looking at this progression, when the penis is starting to suffer from not enough blood flow, that's a canary in the coal mine, right? Telling you something's happening on the vessels that could affect your cardiovascular situation. So ED can be an early manifestation of cardiovascular disease. And if you do have ED, it appears to be the same risk order as if you're a smoker or if you have a family history of MI. So it's significant. So this is a plea for you to go to your family doctor. If you've got erectile dysfunction, 70% of it's going to be a vascular cause. And the other plea is, even if you've never had a cardiovascular event in your life, if you get erectile dysfunction, as the years tick by, your risk of having a cardiovascular event increase. So for example, at 5 years after you developed ED, you have an 11% chance of having a cardiovascular event. So it's a signal to pay attention to your body. It's erectile dysfunction, it's endothelial dysfunction, it's early detection of risk factors. So how does ED start? There's lots of things. It's psychological and it's physical. It's not all about just the vessels, but it certainly is a big factor. Depression is a huge reason why people have problems with their erection. But so is performance anxiety. It's not the slow, relaxed part of your nervous system. That gives you an erection. If you're anxious and stressed out about how your performance is, then the signals down to the penis are not the right ones, and you lose your erection. Relationship problems, psychological, all sorts of stresses and distractions can affect your erection. Physical factors, obviously the blood vessel disease is very important, but you could have injury to your nerves. You could have surgery into your abdomen, your prostate, your bladder can affect the nerves. You could have multiple sclerosis. You can have diabetes where you get differences in your signaling to your lower parts of your end organs, including the penis, and medications. So again, all the reasons for endothelial dysfunction, your blood pressure, your diabetes, your excess weight that Richard was talking about, smoking, it all causes damage to that endothelial lining. And look what you get: stroke, MI, peripheral vascularity, renal disease, and ED. So it's all linked. What are some of the risk factors? We talked about the cardiovascular. The diabetic, man with diabetes, he's got accelerated disease in both his small vessels and his large vessels. And he has peripheral neuropathies. So any man that has numb feet from diabetes is going to have erectile dysfunction. 50% of men with diabetes will have erectile dysfunction. And there's also a smooth muscle dysfunction right in the penis. It doesn't relax so well. So there's 3 strikes against the erection from working well if you have diabetes. Same with nerve damage, as we talked about. Depression is a psychological one, but very important. And if you don't have enough testosterone, you may not have as good erections if you had better testosterone. But the testosterone erection link is weaker than the libido link and the delayed ejaculation. So if you have low testosterone and you're on Viagra, Levitra, Cialis, and it's not working very well, when you replace your testosterone to normal levels, about 20 to 30% of you will start to work to those pills because you've replaced your testosterone. So testosterone plays an important role. So are you at risk? You could be at risk just by increasing age. This unhealthy lifestyle, we cannot stress it enough. I think the message has come across here very clear. There's a great book out called Younger Next Year. Has anybody read that? Younger Next Year? Very motivating. Diet and exercise, but it's written by a really funny guy. So it's really fun to read, and there's some doctor backup. This is what they're talking about. Exercise, exercise, exercise will reduce a lot of this. Lack of attention to the relationship. That is a risk factor for erectile dysfunction. Chronic diseases, we talked about. Some of your blood pressure medications, some of your antidepressants, they're going to affect your sexual function.